Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about cryotomy, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. It will be focused on the sixth subsection of the specialist portfolio called cryotomy. I will discuss knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, evidence ideas, and some helpful tips to make candidates' portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the sixth subsection of the first section, tissue preparation techniques, cryotomy. The knowledge requirement explains what knowledge is expected of the candidate in relation to the relevant subsection. Candidates should be able to demonstrate their knowledge at the specialist level. Think about what knowledge they had as a Band 5 BMS. How would that differ to the knowledge of a Band 6 BMS? That specialist level of knowledge would allow the candidate to troubleshoot, problem solve, verify or validate. The first knowledge requirement, which is principles of cryotomy. Candidate needs to have the knowledge and understanding about principles of cryotomy. You could ask the candidate to explain what is cryotomy, why it is important, when is cryotomy used over routine paraffin wax processing, or what are the principles of cryotomy. When address knowledge requirement, candidates should consider freezing of the samples, temperature control, embedding medium, sectioning technique, slides used, staining protocols, advantages and disadvantages of cryotomy, situations when cryotomy needs to be used, and differences between cryotomy and microtomy. The second knowledge requirement is application of frozen sections in cellular pathology. Candidate needs to have the knowledge and understanding about application of frozen sections. You could ask the candidate to state, why are frozen sections used in cellular pathology, to name the key applications of frozen sections, to state the applications of frozen sections, or why would frozen section be used instead of microtomy. When addressing this knowledge requirement, candidates should consider purpose of frozen sections, situations when frozen sections would be performed, like determining the nature of the lesion, intraoperative diagnosis, margin assessment, during emergency situations or dental findings, confirmation of metastasis, and reasons why cryotomy would be chosen over microtomy, possible artifacts that might affect reportability, turnaround times, high-risk samples, health and safety risks associated with frozen sections, diagnostic accuracy, and so on. The third knowledge requirement is workings of a cryostat. Candidate needs to have the knowledge and understanding about working parts of a cryostat. You could ask the candidate to name the main parts of the cryostat and how would they use them, or you could take a photograph and ask the candidate to annotate it and include short explanation of the function of those parts. When addressing this knowledge requirement, candidates should consider working parts of the cryostat like freezing chamber, cooling system, microtome, chuck, blade holder, anti-roll plate, control panel, hoover and their functions, decontamination options and so on. The fourth knowledge requirement is principles of rapid freezing of tissues and how this relates to ice crystal artifact. Candidate needs to have the knowledge and understanding about principles of rapid freezing of tissue and ice crystal formation. You could ask the candidate to explain what the principles of rapid freezing of tissue during cryotomy are. How could freezing relate to formation of ice crystals? How do ice crystals form during freezing and how to prevent it? What affects ice crystal formation? And what tissue damage can be caused by ice crystal formation. When addressing this knowledge requirement, candidates should consider speed of cooling, source of cooling, surface area and drying tissue surface, size and type, speed of freezing, physical damage due to water expansion, dehydration and solutes concentration, mechanical injury due to ice crystal growth, tissue appearance, detail obstruction, false diagnosis or misinterpretation, compromised further testing. The fifth knowledge requirement is diagnoses that may be made on frozen sections. Candidate needs to have the knowledge and understanding about diagnoses made on frozen sections. You could ask the candidate to name diseases that can be diagnosed on frozen section. When addressing this knowledge requirement, candidates should consider cancer, infections, inflammatory diseases, MOs, metabolic bone disorders, autoimmune disorders, lipid-related disorders or organ transplant viability. The sixth knowledge requirement is preparation of cryostat sections. Candidate needs to have the knowledge and understanding about preparation of cryosection. You could ask the candidate to explain how they would prepare frozen section, how would that differ from microtomy, to name reagents used during cryotomy and why they are used. When addressing this knowledge requirement, candidates should consider SOPs and methodology used, freezing methods, embedding media, thickness of cryosection, temperature, types of slides used, fixation, staining protocols used, cover slipping and so on. The seventh knowledge requirement is risks and hazards associated with the use and decontamination of cryostat. Candidate needs to have the knowledge and understanding about risks and hazards associated with cryostat use and decontamination. You could ask the candidate to name the risks and hazards associated with use and decontamination of cryostat, how they would minimize them, when and how they would decontaminate cryostat, how they would record that cryostat was decontaminated, and to explain the importance of cryostat decontamination. When addressing this knowledge requirement, candidates should consider health and safety risks, infectious risks from Sharp's injury, repetitive strain injury, cold, biohazards, pathogen exposure, fire or explosion risk, UV light exposure, ergonomic setup, preventive measures like use of blade guard, brake, careful approach and safety measures like PPE, COSH, training, risk assessment and so on. Competence requirement is basically a combination of knowledge, skills, and experience candidate needs to perform a job to a satisfactory standard. Candidates' chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this subsection. The first competence requirement is orientate and freeze tissues appropriately. Candidate should be able to orientate and freeze tissue. Does the candidate know how to orientate and freeze tissue for cryotomy? Do they know why is orientation and tissue freezing important? Do they know how to orientate various tissue types during cryotomy and why? Do they know the difference between tissue orientation for wax embedding and for cryotomy? Do they freeze the tissue rapidly to avoid crystal formation? When addressing this competence requirement, candidate could consider SOPs and technique used, their training and competence, various tissue types and their orientation need, the importance of rapid freezing, the diagnostic value of correctly orientated tissue, morphological tissue features demonstrated by correct tissue orientation, impact of poor orientation and ice crystal formation. The second competence requirement is cut frozen sections to the required standard, maintaining audit trails, as appropriate. Candidate should be able to cut frozen section and maintain audit trail. Does the candidate know how to cut frozen section? Do they take the right steps when performing frozen section? Do they maintain correct audit trail during cryotomy? Do they record correct information during cryotomy in correct ways? If not performed in-house, does the candidate know the theory behind cutting a frozen section? When addressing this competence requirement, candidate could consider tissue type, cryosection thickness, traceability, tracking systems used in your lab, limb system used, record keeping, SOPs and methodology used, their training and competency and so on. The third competence requirement is rapidly prepare frozen sections in a timely manner for intraoperative diagnosis. Candidate should be able to rapidly prepare frozen section. Can the candidate prepare frozen section rapidly? Do they know the importance of preparing frozen section for intraoperative diagnosis rapidly? When addressing this competence requirement, candidate could consider speed, immediate surgical decision, rapid patient management, avoidance of second surgery, minimizing anesthesia time, maintaining tissue viability as it is not fixed, and ice crystal formation. The fourth competence requirement is decontaminate cryostat appropriately. Candidate should be able to decontaminate cryostat. Does the candidate decontaminate cryostat appropriately? Do they take the correct steps during cryostat decontamination? Do they know when to decontaminate cryostat and why? Do they record decontamination correctly? When addressing this competence requirement, candidate could consider decontamination after each use, monthly decontamination, use of UV light, hoovering, health and safety considerations, record keeping and audit trail. The fifth competence requirement is perform basic maintenance and troubleshooting of cryotomy equipment. Candidate should be able to perform basic maintenance and troubleshooting on cryotomy equipment. Does the candidate perform maintenance on cryotomy equipment correctly? Does the candidate troubleshoot cryotomy equipment? Does the candidate take correct actions when maintaining and troubleshooting cryotomy equipment? Does the candidate record actions taken in correct ways? When addressing this competence requirement, candidate could consider daily, weekly, monthly and annual maintenance, need for servicing, health and safety considerations during maintenance, potential sources of problem equipment, corrective and preventive actions that can be introduced to prevent problems, record keeping, verification, validation and so on. The sixth competence requirement is evaluate cryostats and blades for routine use. Candidate should be able to evaluate cryostats and blades for routine use. Does the candidate evaluate cryostats for routine use? Do they evaluate blades for use? Do they use correct type of cryostats? Use correct type of blades? When addressing this competence requirement, candidate could consider type of cryostats used, cooling mechanisms, temperature control, precision, consistency, ergonomics, safety, ease of use, quality, regular maintenance, sample compatibility. As for blades, candidate could consider profile, durability, material, sharpness, compatibility, validation, verification. The seventh competence requirement is troubleshoot problems which may arise, including root cause analysis, as appropriate. Candidate should be able to troubleshoot problems, including root cause analysis. Does the candidate troubleshoot problems associated with cryotomy? Are they aware of the common problems associated with cryotomy? Can the candidate perform root cause analysis? Does the candidate keep proper record trail and documentation? Does the candidate know how to contact the manufacturer, if needed? When addressing this competence requirement, candidate could consider potential problems like wrinkled or compressed section, curling, chatter, scores, lifting or cracking, thick and thin cutting, ice crystal formation, anti-roll plate, pre-cooling tools, corrective actions taken, preventive actions, record keeping, verification and validation, ways of contacting manufacturers and so on. Each section also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each section. When they complete all the subsections within each section, they will be required to write a reflective statement. They also need to write a personal reflection on their training and why they chose their evidence. To prepare for that, ask them to write a smaller reflective statement for each subsection. What is their role and context of this subsection within the lab? What does their evidence demonstrate? Ask them to write a smaller justification as to why they chose their evidence for this subsection. Also ask them to write about what was their training like when to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier for them at the end of the section. Each subsection also has evidence of achievement. This is a part where you, the training officer, sign the candidate off as competent and fit to practice as a BMS at the specialist level. By doing that, you will confirm that the candidate can work in accordance with local SOPs relevant to this subsection. This will also confirm that candidate has answered questions set by you to test their knowledge and skills relevant to this subsection. And you will also confirm that candidate's chosen evidence demonstrates their competence, relevant to this subsection. The candidate will need to be signed off as competent by an internal assessor for each subsection. They can be signed off by you, the training officer, senior BMS overseeing relevant section, or by the training lead. These are some example questions you could give your candidate to test their knowledge and skills about this subsection. These should be based around the knowledge and skill requirements mentioned earlier. These are some more example questions you can ask your candidate to complete, to test their knowledge and skills about this subsection. You could ask the candidate to complete tables you created, based on knowledge requirements. Supporting evidence should be selected by the candidate. It needs to be based around the competency requirements and be relevant for each subsection. The evidence should allow the candidate to demonstrate their competence in each subsection. It should be specific and relevant to the candidate's in-house practice. It should also demonstrate candidate's specialist competence. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Link will be included in the video description. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs, or even videos, if they can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be you, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like case studies, for each subsection. They could use experiments, case studies, annotated results, annotated photographs of them performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose something that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the competence requirements in mind when they are selecting their evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirements for this subsection. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those requirements in mind when selecting questions and guiding the candidate. Bye for now.